Learn Chiropractic, Part 1, Principles of Chiropractic. Chiropractic is a healthcare profession that focuses on the relationship between the body structure, mainly the spine, and how it affects whole body function and health. Chiropractic was born out of the belief that the human body has an innate ability to heal itself, a quality that relies on the nervous system. Since the spinal column stands between the central nervous system and the body's tissues and organs, it was theorized that distortions in the spine were capable of impeding the nervous system and therefore health. Today, chiropractic is mostly viewed as a non-drug healthcare specialty for musculoskeletal-related back, neck, and extremity disorders. Chiropractors use a variety of procedures in practice, the primary being adjustments, also called manipulations. Adjustments are carefully directed, short amplitude thrusts done by hand to restore movement and position of a misaligned spinal joint. The intent is to alleviate pain, improve function, and support the body's natural ability to heal itself. Since chiropractic relies on the body's ability to recover from injury and pain, chiropractors also typically encourage patients to take an active role in their health via diet, exercise, sleep, and stress reduction. Doing so aligns with and supports the goals of chiropractic treatment. Chiropractic is generally categorized as alternative medicine or complementary medicine. However, segments within the profession purport to be chiropractic primary care physicians by virtue of their education and training. Chiropractors, also called doctors of chiropractic, are licensed to see patients directly without a referral from a medical doctor, although some health insurance plans require a referral from a primary care physician. To understand chiropractic, consider mechanical engineering. A central principle of mechanical engineering is that structure determines function. A sound structure makes a bridge durable and increases its lifespan, whereas a poor structure can cause it to degrade prematurely and collapse under the weight of cars. Chiropractic shares the same principle. It holds that human structure determines human function and therefore health. The spinal column is the body's primary structural component. It gives the body form and stability. Optimal spinal structure promotes strength, mobility, and good health, whereas suboptimal structure leads to weakness, restricted mobility, and suboptimal health. Mechanical distortions in the spine, called subluxations, are areas where one vertebra loses alignment relative to adjacent vertebra. The subluxated vertebra moves abnormally or may be fixated or stuck in one position. Scoliosis, a congenital disorder, is an extreme but rare example of subluxations in the spine. Subluxations occurring from physical trauma such as falls and car accidents, poor postural habits, excess weight, and weak muscular support are much more common, affecting nearly all adult human beings. While subluxations can cause symptoms such as pain, discomfort, and reduced flexibility, most are asymptomatic or unnoticeable. A subluxated vertebra impedes the spine's mechanical capacity to move fluidly and balance weight. It also forces other vertebrae in the spine to move abnormally or compensate for the restriction. Over time, this abnormal movement leads to spinal degenerative changes, accompanied by pain and loss of mobility, the two main reasons why people see chiropractors in the first place. Since nerves reside inside and around the spine, subluxations have the potential to place pressure on these nerves and degrade nerve signals to and from the brain. Because of this, it is believed that subluxations can also lead to organic disorders such as headaches and indigestion. Chiropractic is the art and science concerned with identifying subluxations and reducing them using manual techniques delivered by hand or instrument. Chiropractic theory holds that when a spinal subluxation is corrected, that is, when its normal position and movement patterns are restored, symptoms clear locally and sometimes in distal regions due to the integrated nature of the musculoskeletal system. A mechanical distortion in the pelvis may cause hip pain and compensatory shoulder pain distally. Correcting the distortion in the pelvis can alleviate both areas. Since chiropractic has long been anecdotally observed to accomplish such health benefits, it is considered not only a specialty for treating spinal problems, but also for wellness and prevention. Fundamentally, chiropractic holds that overall health is improved and pain is lessened when the spinal column is aligned, properly moving, and is not encroaching upon nerve tissue. The goal of chiropractic treatment, therefore, is to reduce mechanical distortions in the spine so that this can be achieved.